So John, we were talking right before surgery about a flap. That's exactly what you had. So this flap, when it's sitting in the joint, will feel like a rock inside your knee. When it's sitting outside your joint, like back here, like it was before, you're not going to feel anything because it feels pretty normal. So this is the flap that would have been bothering you, and certainly, as we talked about in front, taking this out is going to make you feel a hell of a lot better. You're not going to have that instability anymore. Now look at your cartilage joint space here. Pretty worn down on this femoral condyle. That's not going anywhere. You've got an area here that's almost down to bone. So you're also pretty arthritic. We can get rid of this meniscus. I'm going to come back here and amputate that small piece. And then we'll see what kind of arthritic changes you have. So we'll take this little biter. The grasp ring, I'll grab it. All right, let's take this piece out now. We'll take it right out of your knee. Come a hemostat. Go there, Paul. So you're left with all the meniscus back here. We left with a cleavage tear because I think it's a pretty stable tear. Your flap is gone. There's nothing flapping back here. It should do. I think we got it nicely beveled. We're going to clean up the transition. You're pretty worn down there. Let's look at the rest of your knee first. Here's your anterior cruciate ligament, your ACL, PCL. Both of those look great. We're going to come down and look at your lateral meniscus. We'll bring this up and across. This is the outside of your knee. You'll see that the meniscus underneath looks great. Looks good up on top. Here's your popliteus tendon. And here's your meniscus up front. So then we're going to bring this down into a little bit of flexion. You see how this articular surface here is a little bit worn down here, a little bit early arthritis. You'll see up front here, I'll bring this down into a little bit of flexion. Yeah. Looks pretty good. Let's go up on top by your kneecap, and unfortunately your kneecap is a little bit worn. Look at that trochlea. You've got almost pure bone exposed here. That's the crunching and creaking you see by your kneecap. And if you look up on top, you're going to see a kissing lesion here on the patella. That's pretty worn down. So let's come from the other side and just clean up the transition area, and we should be set. All right, so here's your articular damage, a little bit arthritis there. Your meniscus looks great in back, looks good in the mid portion, and then we left you with a nice transition zone up front here. It looks like we're going to wash you out, and we're done. All right, let's blue plug. We're good, Mo.